Next presenter is Dr. KAVITA. She will talk on retinoblastoma with Staphyloma, Clinico Radiological Profile and Outcome. Dr. KAVITA.
Good afternoon, everyone. Today I am going to present retinoblastoma with Staphyloma, Clinico Radiological Profile and Outcome. So, RB is most common primary intraocular malignancy of childhood. It accounts for 3% cases of all childhood cancers. Staphyloma is defined as outpouching of the sclera with its curvature of radius being smaller than the curvature of the surrounding eyeball. Myopia, end-stage glaucoma, choroidal melanoma, trauma are associated with Staphyloma. To date, no studies have specifically focused on the clinical outcome and treatment implications of Staphyloma in RB patients. So we speculated that the presence of Staphyloma might influence the prognosis and the likelihood of globe salvage, given the potential complications such as scleral thinning and increased risk of extraocular tumor spread. So, few clinical features which are associated with high risk feature on histopathology such as longer lag period, hyphema, pseudohypopyon, staphyloma, orbital cellulitis. These are the high risk features like post-laminar optic nerve infiltration, involvement of the optic nerve transaction limit, extrascleral tumor extension, choroidal invasion. These are universally accepted by the ocular and pediatric oncologists, while anterior chamber invasion and ciliary body invasion were considered as high risk feature by few ocular oncologists or pediatric oncologists. So our aim was to study clinico-radiological profile and outcomes of retinoblastoma eyes with staphyloma. This is a retrospective case series of 13 patients from January 2019 to May 2024 with ciliary staphyloma clinically or having a scleral staphyloma on imaging and who had taken complete treatment. Those who refused for the treatment, did not complete a treatment or having extraocular involvement were excluded from the study. The demographic details, clinical, radiological and histopathological data were analyzed and treatment outcomes were measured in the form of globe salvage, event-free survival, recurrence and death. So we divided the staphyloma in 3 categories: ciliary, pre-equatorial and posterior. So our total 13 number of patients with mean age at presentation was 16.5 months. Mean duration of symptom was 17.4 weeks, which was lesser in group E eyes as compared to group D. 9 patients had group E retinoblastoma and 4 had group D, while white reflex has most common presenting symptom. So in group E eye, 1 eye had ciliary staphyloma and 8 eyes had posterior staphyloma, while in group D, 1 had ciliary, 2 had preequatorial and 1 had posterior staphyloma. 3 eyes were undergone primary enucleation, 6 were undergone secondary enucleation and 1 globe was salvaged. This is group ERB having posterior staphyloma on imaging. So in ciliary staphyloma, 1 patient had PT3 staging on 8th AJCC PTNM. Anterior staphyloma, 1 globe was salvaged, another one had PT1. And in posterior staphyloma, 1 patient had anterior chamber invasion under PT2 and 2 patients had PT3. In posterior staphyloma, 1 patient was died because of CNS metastasis and 1 patient had recurrence 6 months after enucleation. This is the group D, uncontrolled group D RB who had recurrence in inferior orbit 6 months after enucleation. It was treated with EBRT and adjuvant chemo. Now he is doing well, 1 year follow-up. So there are some clinical features at presentation which could predict high-risk pathology such as staphyloma, orbital cellulitis, glaucoma and UVS, NVI. This may help oncologists and ophthalmologists in deciding the need for prophylactic chemotherapy in the absence of histopathology report. To summarize, posterior staphyloma was more common in group E, while pre-equatorial in group D. High-risk features were more common in posterior staphyloma, and pre-equatorial staphyloma has good prognosis, as out of 2 eyes, 1 globe was salvaged and another one had recurrence. To conclude, posterior staphyloma exhibits more high-risk feature on histopathology. This necessitates more aggressive and early intervention. Thank you. Thank you.
Now, how do you compare about without staphyloma and staphyloma? Because this is just about staphyloma.
This is staphyloma.
Yeah, so any cases of anterior staphyloma which were there? No.
No, sir. Only ciliary staphyloma, which 4 to 5 mm from the limbus, or scleral staphyloma on imaging, like posterior staphyloma between the optic nerve and the lateral rectus muscle, or anywhere else.
So would you give a definitive inference about doing this study? That staphyloma is having an impact on the recurrence part or any prognosis?
Sir, there is only one study which suggests that
About your study, what you have inferred. There are studies, but what is your inference in this study?
Yes, sir.
What something different or something?
Sir, in case of staphyloma, we found that out of 13, only 3 patients had high risk feature on histopathology. Out of these 3, one had choroidal invasion, another one had optic nerve and choroidal invasion, and one patient had scleral invasion on histopathology. So we could not say because of staphyloma whether there is a scleral
So there
involvement.
is no correlation between the staphyloma and the recurrence part or the high risk.
High risk features.
Okay, right. Thank you.
Okay, thank you, sir. Local recurrence and mets.
Recurrence and